Hello and welcome to Clinical Exam Series with Dr. Piro. Today we are going to be discussing cerebellar examinations. Your exam is usually going to last between 3 minutes to 5 minutes for your OS case. Use 3 minutes to practice to be on the safe side. As in all examinations, make sure you greet the patient, obtain an informed consent from the patient, screen the patient appropriately, and use PPEs while you carry out the examination. There are 7 core aspects of cerebellar functions to assess for when carrying out these examinations, and this reflects the functions of the cerebellum. They are intention tremor, dysmetria, dysdiadochokinesia, pronator drift, Rhombec test, tandem walk, and heel to shin test. Intention tremor is quite different from the resting tremor that is associated with Parkinson's disease. To assess for intention tremor as well as dysmetria, we place our fingers in front of the patient and we ask the patient to repeatedly touch their nose and touch the tip of our fingers. At the same time, we begin to move our fingers in front of the patient to the left and to the right. If the patient has tremors while attempting to touch the tip of our fingers, it indicates intention tremor. Inability to accurately judge the distance between their nostril and the tip of our finger will point towards dysmetria. The next phase is to ask the patient to perform rapidly alternating hand movements. If the patient is unable to carry out this movement, we say the patient has dysdiadochokinesia. The next test will be the pronator drift test. Ask the patient to supinate, to hold their hands in front of them with their palms facing upwards, and ask them to close their eyes subsequently. Patients with cerebellar lesions will pronate and drift. That is what is called the pronator drift test. The next test is the Rhombec test. Rhombec's test assesses sensory ataxia. We ask the patient to stand barefoot. Patients with cerebellar lesions will typically fall forwards or backwards. The next test is the tandem walk. We ask the patient to walk by subsequently placing the heel of one foot to the toe of the other foot. This is called the tandem walk. Inability to carry out this task can point towards cerebellar lesions. The next test is to assess the gait of the individual. We ask the patient to walk 10 paces, turn around and walk back 10 paces. I should also tell you that in exam situations, it is advisable to walk alongside the patient to avoid falls and injuries. The last test is called the heel to shin test. This is carried out with the patient lying supine on the bed. We ask the patient to rub the heel of one foot to the shin of the other foot downwards and upwards. Inability to carry out this heel to shin movement may point towards cerebellar lesions.